Rayborn, and this is Deliverable 1, Analysis of a Healthcare Information System. How remote patient monitoring has revolutionized my nursing practice. Remote patient monitoring, also known as RPM, is a healthcare technology used to monitor and manage a patient's health remotely. It involves collecting health data from individuals at one location and transmitting it to providers for evaluation, diagnosis, and ongoing care management. This technology enables better management of chronic condition and allows for timely interventions, potentially preventing complications. RPMs offer several benefits: device integration, data transmission, and real-time monitoring. Devices are often connected to smartphones, tablets, or computers to send real-time data to healthcare providers. This data is then stored in a secure cloud-based platform where providers can easily access it. RPM systems typically have alert features that notify healthcare providers of abnormal readings or trends, allowing for quicker responses to potential health issues. Some key features of RPM include use of wearable devices that can track vital signs such as heart rate, blood pressure, blood glucose, oxygen levels, weight, and ECG readings. Some settings for RPM use include home care. Home care settings allow patients to be monitored from the comfort of their own homes. Hospitals or clinics. These systems are used to monitor discharged patients or those who are in transitional care, ensuring they are stable and recovering as expected. It also allows healthcare providers to extend their monitoring capabilities without requiring constant in-person visits. Specialty patient populations, including chronic disease patients, the continuous collection of data helps in tracking disease progression, medication adherence, and more. These populations can include patients with diabetes, hypertension, heart disease, asthma, and COPD. Also, specialized monitoring centers. Some healthcare systems have established dedicated centers to remotely monitor patients' health 24/7. These centers include staff who review patient data regularly and escalate care as needed. So RPM, why use this technology? RPM offers early detection and prevention. It allows for early detection of deteriorating health conditions or sudden changes in vital signs. One example of this is patients with heart failures. If they have a sudden weight gain, the RPM can alert the physician to initiate treatment before the situation escalates into a potential hospital admission, which leads to also a reduced number of hospital readmissions. RPM can reduce the likelihood of hospital readmissions by allowing continuous monitoring after discharge. Patients with conditions like COPD or heart failure are often at high risk of readmission, but remote monitoring ensures that healthcare providers can act swiftly if the patient's health starts to decline. Cost reduction. RPM reduces the need for frequent in-person visits, which can be costly and time-consuming. It also minimizes hospital admissions and emergency room visits. Patients can benefit from more efficient care, leading to better health outcomes and cost savings for both physicians and healthcare systems. Increase access to care. RPM is especially beneficial for those patients who live in rural or underserved areas where their healthcare access may be limited. It allows these individuals to receive high quality care remotely without needing to travel long distances. These devices can provide feedback to patients, such as reminders to take medications or engage in physical activities, to also encourage use and participation, which leads to patient empowerment. RPM empowers patients to take an active role in managing their health. They can track their progress, communicate directly with healthcare providers, and make informed decisions about their lifestyle and care. Lastly, RPM systems can also help to improve patient safety by identifying early warning signs that patients may be decompensating. According to the American College of Nurses and the National Academy of Sciences, Engineering, and Medicine, the nursing informatics scope and standards of practice provide a framework for integrating nursing practice with information technology. It outlines the roles, responsibilities, and expectations for nurses in the field of nursing informatics, ensuring that they utilize data and technology effectively to improve care to patients and healthcare outcomes. In terms of scope of practice, the AACN focuses on data management in the informaticist role. RPM has helped me become more efficient in collecting patient data, which has in turn supported my clinical decision making as a nurse. RPM has significantly transformed my nursing practice by expanding my scope of care. It has helped me improve my efficiency as a provider and has enabled a more proactive and personalized approach to how I care for care for and treat my patients. As nurse informaticists, we collaborate with interdisciplinary teams to optimize care delivery through information systems. This is also a primary focus of the AACN's nursing informatics scope of practice. RPM systems have made it easier to share real-time data with other providers, allowing for better care coordination. Furthermore, the AACN also focuses on systems design and implementation. As a nurse and an informaticist, I am often involved in the selection, design, and implementation of healthcare technology systems to ensure they meet the needs of our patients and providers. RPM systems promote more effective communication between patients and providers. Ensuring a healthcare system is mutually beneficial for both parties is imperative to ensuring that a product will work long term. The AACN also outlines specific standards to guide informatics practices. Some of these standards include assessment, analysis, planning, implementation, and evaluation. Nurse informaticists also advocate for the appropriate use of this technology, ensuring that it aligns with best practices, improves care, and benefits patients. RPM systems have been shown to support these standards by providing real-time data for assessment, identifying needs, identifying trends for analysis, and collaboration with providers for treatment planning and implementation. In conclusion, remote patient monitoring has revolutionized my nursing practice by empowering me as a provider to deliver more proactive, efficient, and personalized care. It has enhanced my ability to monitor patients remotely, reducing the need for in-person visits. Patients have improved outcomes through early detection and intervention from data gathered from these systems. They've provided real-time monitoring and care for our vulnerable patient populations, including rural patients, chronic illness patients, and those that are elderly as well. Adhering to the AACN's informatics scope and standards of practice while using this technology has helped me to feel empowered as a provider and has positively impacted my relationship with my patients as well.